name is Dr. Vanessa Holland, and I'm a consultant pulmonologist with the Methodist Neurological Institute in Houston, Texas. My primary responsibility is taking care of neuromuscular patients. During Hurricane Harvey, which was in August of 2017, that was an eye-opening event for all of us who was in the Houston area. People have lived in Houston for a long time and never flooded. However, during the Hurricane Harvey, there was an unprecedented amount of rainfall, which ended up to be about approximately 27 trillion gallons of water. During that time, the city was immobile. People could not get from one place to the other because it was completely flooded. We lost electricity because there was no one to come into the area if you had a fire. During that time, I received phone calls from patients with neuromuscular disease who didn't leave, and so they were calling with medical emergencies. At that time, they called EMS. EMS couldn't rescue them with a boat on a ventilator. They called EMS, said that they couldn't send a boat and they couldn't send an ambulance because they couldn't pass through the water. We had to do out-of-hospital emergencies for people with hypotension from an infection, low blood pressure. We improvised with Gatorade. We improvised with antibiotics they had at home. They got on social media and got the neighbors to bring them Gatorade, antibiotics, until such time that they were able to get an ambulance in there and take them to the hospitals. Hospitals were closed because they had flooded. There were no supplies because no truck could get in. So during that time, the phone calls that people were providing, you had to improvise. In addition, those who did leave didn't take some of their equipment with them and ended up going to different cities and had to be hospitalized. But fortunately, we had no deaths. Those are some of the things that happened. We had patients who we asked to evacuate who decided to stay and hunker down. What that means, they are going to stay regardless of being told to leave, and they are going to improvise to make sure that they are able to stay in their home. One of the problems is if that bottom level floods, you have to be able to move up to the second floor. Now, they were dependent on their neighbors to come move them up to the second floor or go to their neighbor's house. However, we had second floors that were flooded. And fortunately for them, it didn't happen, but it could have happened. And so our recommendation for a lot of the patients with neuromuscular, vent-dependent, non-invasive vent-dependent, you need to leave. It's safer to leave than stay there and wait because EMS is not going to come. If your city is flooded, you will have volunteers trying to get to you, but you're going to be in the list of people to get to. What I suggest to the people, if they're going to stay, you need to put together a stash for yourself. And I call it a stash because you need to have antibiotics, you need to have equipment to do bagging, suctioning. I tell them to get some Gatorade, get some Pedialyte, anything they're going to need to survive. Because if EMS can't come get you, it may be 3 days, electricity may be 2 weeks. They don't turn electricity on just to one person. They usually turn electricity on to the larger group of people that they can get to in a safe way. If it's not safe, it doesn't matter. You're not going to get electricity. Battery life on those respiratory assist devices can be 4 hours. It can 4 to 6 hours. But if you're out of electricity for a week or two, that's useless. So thinking that you're going to go to a hospital and the hospital is evacuated because it's taking on water is unrealistic. So our recommendations for people in natural disasters, if you have a lead time, it is best to leave the area. You can always come home and deal with the circumstances, but you don't need to be there and take on exceeding another illness, end up being hospitalized for pneumonia, getting sepsis, or something else when you can get out of the area.